Good morning, everyone. So nice of you to join us today. We're really excited to be here with you. What we're going to do is we're going to do some quick introductions. You are in the session, the San Diego County Medical Society and Champions for Health COVID-19 response. We hope to sort of give you an idea of what we've been doing and also give you a chance to ask us some questions. I'm going to start by having Andrew Gonzalez introduce himself. Go ahead.
Hi, good morning, everyone. First of all, if you want to stretch out really quick, because you know it's a Thursday before the break, it's 9 a.m. But my name is Andrew. I am the Director of Community Health for Champions for Health. We are the foundation side of the San Diego County Medical Society and happy to be a part of the conversation.
Jim.
Hi, I'm Jim Schultz. I'm a family physician, chief medical officer at Neighborhood Healthcare, and was the San Diego County Medical Society president at the time that COVID hit us. And I'm not going to stretch because you'll hear all kinds of weird popping noises that my joints will do because I'm old.
And I'm Holly Yang. Nice to meet you all. I am the immediate past president, was president of the Medical Society from May 2020 to 2021. We all stay very active in all of the activities of the above. So thank you for joining us today. What we're going to do is basically try to give you some information about sort of what happened as the pandemic evolved, both from the Medical Society side, as well as the Champions for Health side, and sort of how we've tried to reach out and support our physicians and healthcare workers, as well as our community in San Diego, and partnering with community-based organizations to do that, because this has been an all hands on deck event, as all of you know. So it's been really important to us. Jim, I think you get into a little bit of who we are and what we do. So I'm going to let you go ahead and start. But we'll have a chance for question and answers after we've talked a little bit about sort of what's happened so far. And then after the Q&A, we'll give you an idea of how you can get involved if you'd like. So go ahead, Jim.
Great. Thank you, Holly. I'm going to attempt to share my screen. I'm a doctor, not a professional Zoomer. So hopefully you all can see that. You should be seeing a slide that says Live Well San Diego Advanced 2021. So first I want to talk a little bit about who we are and what we do. So first of all, the San Diego County Medical Society, we've been around since 1870. I wasn't here then, I'm not that old. We have about 4,500 members, and what the Medical Society's role is, you can see it spelled out here on the slide, but basically we're here to promote the science and art of medicine and improve the quality of care and well-being of the patients, the protection of public health, the betterment of the medical profession, and kind of making sure that the doctors that are working in our community are up to ethical standards. A big role for the Medical Society is to educate its members and thereby all of the members of the community. So really the Medical Society is designed to support physicians so that we can practice the best medicine that we can, high quality medicine, evidence-based medicine, with as little interference in our ability to practice medicine as possible. The Champions for Health is a part of the Medical Society. It's an independent organization, but it was originally started as the foundation for the San Diego County Medical Society. Some years ago, we changed our name from San Diego County Medical Society Foundation to Champions for Health, because really it kind of better represents what Champions does. What Champions has been known for doing for many years is rounding up physicians who are willing to volunteer their services to patients that can't otherwise access care. So we have our community health centers. I work at one of those, and the community health centers are really good at providing primary care to unfunded and unfundable patients, as well as the Medi-Cal population. But sometimes people need care beyond what the community health centers can provide. So Champions for Health finds physicians who are willing to donate their services, specialty care, consultations, surgeries, even very complicated surgeries at times, and gets those done for our community members that really don't have access. We do a lot of community outreach efforts. We do education to the general public. We round up volunteer physicians and others that go out to service organizations and community groups and provide education. And we've been doing vaccination efforts out in the kind of harder to reach areas of our community for a number of years with flu vaccines. And then Andrew will tell you about our COVID vaccines effort. We sponsor a number of community events or attend a number of community events, such as charitable races and things like that. And we're involved with important work in the Alzheimer's space with educating primary care and other physicians and families about Alzheimer's disease. So what did we do is from the medical society point of view? So to take you back to March of 2020, a number of us, pretty much the whole medical community, had to make a pivot on the dime and turn their medical practices either into closed, non-functioning practices because of the risk of contagion and the lack of personal protective equipment, or we had to switch to doing a lot of our care virtually on the phone or on video. So what the Medical Society was able to do and kind of focused on during the initial part of the crisis was really helping physicians keep their practices open so that people had a doctor to go to. And that was some technical advice. It was really kind of boots on the ground, supplying PPE, opening up supply chains on PPE, and actually delivering PPE to physicians' offices and having a repository at the Medical Society where physician office and office staff could come get PPE when they really sometimes couldn't get it anywhere else through their normal supply chains. About almost half of the physicians in the Medical Society are in a small group or solo practice still. So this, we have lots of big, excellent groups in San Diego County, like Sharp and Scripps and Kaiser, and we have a lot of medium-sized groups. And these folks, a lot of these are attached to hospital organizations, so they have more resources in general for everything. And so the small groups and solos really were the ones that were having trouble identifying sources for PPE, and then later on testing equipment, and then after that vaccines. So we're the Medical Society worked with suppliers, worked with the California Medical Association to get these type of supplies and just expertise as to how to navigate virtual visits. There was a lot of questions about, like, how do we bill for telephone visits and video visits? Are they going to get paid? So the Medical Society and CMA worked with payers and kind of on the statewide level to make sure that the work that the doctors were doing would be reimbursed so that they could really keep their doors open and keep paying their staff. The Medical Society also helped identify and distribute grants, both locally and on the statewide level. And we provided a lot of testing supplies and information and just supportive, sort of knowledge-based type support of what are these tests actually testing? What do they mean? How do we interpret them? And then again, sort of practical, how do we get testing supplies? Because those supply chains were unclear initially. And then later on, vaccine supplies, info, support, et cetera, all of the confusion about who gets the vaccine when, what groups are eligible, what groups are not, just really getting the information out to the physicians so that everybody was on the same page. We really function as an information center or repository, and we were able to get information from ahead of time of what was going on with COVID, because as you remember, COVID hit China, then Thailand, then Southern Europe, and then the East Coast before it really walloped us on the West Coast. And so we were able to kind of get some intelligence from those areas based on, 4,500 physicians. We all have friends around the country and around the globe that we can get information from. So we did a lot of that because there was so much that was unknown that even getting information a week ahead of time or a few days ahead of time was really prepared us and allowed us to strategize as to how we're going to deal with the COVID. And we got that information out to our doctors. One of the big things we did, and it really started with the county, Dr. Nick and the Hospital Association of Southern San Diego and Imperial County, and the Medical Society, we started doing weekly town halls, and that was really kind of closed to just physicians because there are a lot of technical medical information, especially at first about COVID. And on these, we brought in people from New York City and Germany and Italy and other areas of our country to talk about what was going on there, how they dealt with the situation. So this was very helpful. We had over 200 attendees on the town halls, most of the early on, especially. We continue to have these periodically when new things pop up, like when the vaccines came out, when different age groups are becoming eligible. As the Delta strain reared its ugly head locally, we've had these town halls ongoing, but they're not every week anymore. We even got into, because COVID doesn't have borders, none of our infectious disease recognize political borders. So Tijuana and Mexicali were really drowning in COVID, and were much less well equipped than we were on this side of the border as far as PPE, medical intelligence, medical information, clinical guidelines and pathways, and just facilities. And so the Medical Society was able to get a team of experts from UCSD, Sharp, Scripps, including nurses and physicians, infectious disease experts, intensive care experts, and really get the ball rolling on having an ongoing support strategy for both Tijuana General Hospital and the General Hospital in Mexicali. And that included, you see some pictures here of us donning PPE in the Tijuana General Hospital as we were about to go into the COVID unit. Early on, I think this was probably early May of 2020. And that turned into ongoing support where a team from UCSD, Sharp, and Scripps kind of took turns. Mostly UCSD would go down and provide support with physicians going to both Mexicali and Tijuana, and nurses going to both Mexicali, Tijuana, and training the doctors, training the nurses, and providing some limited supplies to help their ventilators work better, among other things. And then in addition to that, we started doing weekly grand rounds where every Monday morning and every Wednesday morning, we would have grand rounds with the doctors in Tijuana or in Mexicali, talking with the UCSD, Sharp, and Scripps doctors on this side of the border to present cases, to use cases to teach the doctors down there. We were working with some of their residency training programs in both Tijuana and Mexicali to just kind of leverage our expertise, and also to honestly to learn from them, and what they learned we used on this side of the border too. The other thing that the Medical Society did is we really kind of rounded up our physicians to respond to help in certain high need areas. So there were some additional access points to treat COVID patients that didn't require intensive care or that level of care, but still required oxygen and couldn't be treated at home. These alternative care sites were opened up in Imperial Valley and in Orange County, most locally, and then kind of across the state. So many of our doctors went and volunteered at some of these sites. We worked to build the Medical Reserve Corps. Some of our doctors have been helping out on the vaccination efforts, and we've been getting some of our folks into local nursing homes to help when the staff there has gone down with COVID before the vaccines, or just helping when people are burned out. So that's a picture of me and my PPE going into the alternative care site in Costa Mesa. So that was where I got deployed on CalMat. I think that's all I have to say. I'm going to turn it. I'd like to hear from Andrew from his point of view about what he was feeling and what he was doing throughout this whole COVID episode. I'll stop sharing my slides. Thanks.
Thanks. I don't have any slides, but watching that presentation gave me flashbacks. Also triggered me. So thank you, Dr. Schultz. But thank you to everyone again for being part of the conversation. I had an interesting point of view because we work with so many doctors and we're part of the medical society, but we're also a CBO in a way, right? And so most of you here, I'm assuming, if you're not supporting the medical society right now, if you're a physician, hey, welcome. Most of you may be a CBO and also may not be part of that world. So I'm glad that you're able to see the work that was being done behind the scenes, because it's amazing work. The doctors and nurses, I know we hear it all the time, you know, they are our healthcare heroes, but they were doing so much work behind the scenes across the border and just making sure that we were all safe, not just for our community, but themselves too. And prior to COVID, before the vaccines came out, some of you may have worked with us in the past or may know of our program, but we do have our Speakers Bureau program, Live Well Speakers Bureau. And so we were in it doing a lot of COVID presentations because everyone had questions, right? And what was so interesting and hard is that things changed every week. We would have a county approved presentation one week, and then all of a sudden there would be an update that something else would happen. So we always had to be on the go. We always had to be on top of our toes for the updates so we can share the most up-to-date information to our community members. And one of the focuses, or the main focus at what we try to do, our mission is that we want to make sure that we try to reach not just everybody, but really the hard to reach, right? So that means that we had to make everything available in multiple languages. So if you're not aware, there are 7 core spoken languages in San Diego County. That's Arabic, Vietnamese, Mandarin, you know, all these other languages beyond English and Spanish that we also needed to make sure things were translated in, and that we had healthcare providers that were able to do that presentation. And as everyone learned, right, we had to go online, we had to go through Zoom. It took us a while. We're still learning. You know, sometimes we're on mute, sometimes we don't know how to share our screen. So trying to make sure that we were able to meet the demand and really be able to meet the folks who are the most high risk was a challenge. And so I remember doing a presentation at last year's Live Well Advance, kind of talking about the same thing, how we were able to educate so many people, because from March 2020 to I think June 2020 or July 2020, we educated over 8,000 San Diegans, all virtual. That's a lot. And thanks to our doctors and our nurses who gave the time. Thank you to our county people who are always on top of it and trying to deal with all the craziness and with the updates. And then as flu season hit, because as mentioned, we have been doing our community-based work with flu for the past, I think, 6-7 years. One of the best ways prior to COVID vaccinations to protect yourself, of course, with masks and hand washing, was to get your flu shot. So we were out there going to churches and supermarkets and all these other high-risk areas, especially if you imagine those maps, right? Those maps of COVID cases, red, orange, purple, all the colors. We were going to those areas to make sure that people had at least another layer of protection. So It was a great experience, but as mentioned, it was very interesting kind of learning and seeing two sides, hearing all the updates and information from the town halls, seeing these two wonderful healthcare heroes that you see in front of you, answering questions, working with their colleagues, hearing professionals from Italy. I think that was a great town hall, trying to see, at the time, Italy was having a really bad outbreak and a lot of people were passing away. And a lot of healthcare workers were also dying, and trying to figure out how can we learn from them of what was happening here. And I think that was a great tool for us on our end as Champions for Health to also not just educate the healthcare workers that were volunteering with us, but kind of share that information with the community about this is how we're doing it. This is how we're learning and working together across the globe so that we can make sure everyone is safe. And when it came to influenza vaccines, flu vaccines, typically we've done around 3,000 to 4,000 on average for the past couple of years out in the community. And we don't ask for insurance. We work with the county. Shout out to the county for working with us to make sure that people have access. We did over 8,000 vaccinations within 3 months. That's the highest amount of demand that we've ever had because people really wanted to protect themselves. And we're seeing this now too, as we're doing COVID and flu vaccinations. Within a month alone, we have done close to 3,000, if not more, of just flu. So it's been a great honor and it's been a great opportunity. I'm really tired, but as we all are, right? But for any of you who have been working, or if you are a CBO and being out in the front lines, you know the people that you work with, you know the clientele, the families, and those that are really high risk, just making sure that they're safe, they have the most up-to-date information, and that they have the resources that they need. And so it's been really, again, an honor to be part of the team, even though it's long days, long nights, but you know it's worth it. But again, triggered. And Dr. Yang, I guess if you remember how it was a while back ago.
Yeah, it seems far and it seems close at the same time. I know everyone is, we've been grateful for all of the partners we've had during this time. It was a much more active president-elect year than I anticipated, Jim, because certainly the time all bleeds together is just pandemic as opposed to a year per se. But
sorry about that, Holly.
No, yeah, well, I know you did not plan the pandemic, so. But just really grateful for everyone's work, and to all of you out there who've been doing work in your communities, to the county. This is always partnerships. And I would say if there's one silver lining, I think that people have been working together in incredibly powerful ways that probably we haven't in the past, or at least to the intensity that we have in the past. I'm really proud of the work that everyone's been doing for San Diego. I just remember, I feel like I was a broken record, and I still am, that I, just getting the word out to the community, please wear your mask, please wear your mask, please wear your mask, wash your hands. At the beginning, we didn't have vaccines. And so that was what we had, and it worked well. And at the same time, people were struggling. They needed to work. They were worried about their kids. And that was true for our physician community as well. They're trying to take care of patients, and their kids are running around their house. And I think one of the things that our physician community was most afraid of is bringing the disease home and hurting their own family member. We're willing to take care of patients. That's our job. And I think that just the amount of stress that our community is under, and I think also many of you felt that was really difficult. We started listening to and attending the Board of Supervisors meetings during this past year, because we know, unfortunately, that public health officers have been under attack in our community and all around the country, and people have quit all around the country when we need them the most because of harassment and abuse. And so it was really important to us early to stand up for Dr. Wooten and the whole public health staff when needed at the county, because even within California, we've seen people harass folks. And so it's been, and that's just frankly unacceptable. I have strong feelings, as you would expect, about those kinds of things. And so it's been important for us not only to sort of be out there in the community, to be in the hospitals and in the clinics and taking care of our families. But then there's this extra layer of having to be out there on social media, doing events in public, on Zoom, to educate. That's not part of our normal day job. But in fact, if we're not out there, then the misinformation and disinformation is what is overwhelming. And so we have to counter that with information, even at the Board of Supervisors meetings, to sort of say, hey, medicine says that masking is what we need to do to take care of our families and to help decrease the spread. And when people were in stay-at-home orders, that was really hard. And encouraging people to hang in there and the importance of those things. So one of the things we did was we launched our first social media campaign for when Dr. Wooten, unfortunately, someone doxed her or shared her information publicly. It's been a while, it's been over a year since that happened now, but I wanted to show our support for her specifically. And so it was actually quite an uplifting thing in that we got docs to send in pictures of themselves wearing masks. And this was around sort of a masking, people were mad about masks. And so wanted to show that our physician community backed Dr. Wooten and backed masking, that this was absolutely based on science, and that we wanted to show that our clinician community felt this was really important. You can see our one of our panelists here with his dogs. We have trainees in emergency medicine. We have medical students that were supporting us. We had families, people got their kids involved. This was really fun to see people's kids. We had well over 100 pictures that were sent in to us. And then it spread to other places outside of San Diego. So the impetus of this was because Dr. Wooten had, and our public health officers, all our public health staff have been dealing with this. But our medical societies in other parts of California stepped up. So Orange County, unfortunately, they had a lot of trouble with people attacking their public health officer. But Jason Cord, who was president at the time, joined in. Same for people from San Francisco Marin, San Bernardino. We had people from all over. There's so many pictures. And then we actually had people in the community who joined in. So members of the public, nurses, social workers, even some people had fun with it because our hashtag was I support my PHO. And this, I don't know Matt, but I enjoyed his comment that it makes him think of pho, but also he supports his PHO. So he thought he got hungry looking at all of our posts. But social media can be fun, and it's also important to get the right messaging out in whatever way we can. So that was important. The town halls, we continued, as Jim said, we were literally schlepping boxes into the back of people's cars in a big event that we had at the old Qualcomm Stadium. I've been grateful to be part of the San Diego COVID-19 equity meetings that the Multicultural Foundation and Dr. Hood pulled together. That's been incredibly important to sort of think about how do we not only protect our community, but think about health equity, because as we all know, there are communities that are much more deeply affected by inequities in healthcare, and unfortunately, those are the ones who've suffered the most under this pandemic. And so, I'm really trying very hard to not lose an equity focus when getting wrapped up in everything else that's going on. So, in fact, trying to keep a laser eye to that, or make sure we're incorporated in everything that we try to do. And then when the vaccines came, that's a new fight. So, we've been dealing with the issues around masks and disinformation there. And then when the vaccines came out, it was a great relief. We had people driving through Petco and driving through, up at the racetrack and all, UCSD and Scripps and Sharp and so many healthcare systems and private offices did so much work to get immunizations out there. The county, people were volunteering. I mean, I was so impressed to just see all of that. And then champions and many groups going out into the community, going to where the people are, because not everyone can drive themselves to a mass vaccination site. And so really critical to get to be in the community with trusted community members, giving them the information, because people don't know what to believe, right? So that information and what we continue to do now is actually deeply important. So I think that fight against disinformation and getting things out whether it's to people who are homebound or nursing homes, has been a big deal. So Andrew, I want to go back to you because really you've been helping, and I don't think you sleep, getting COVID vaccines out there into the community and working with a lot of wonderful other organizations and partnering to do that, because we're as powerful as our coalitions, right? So I wanted to pass it back to you. And I will just say, if you guys have questions for us, stick them in the chat. I'll be keeping an eye on that, and we'll have a chance to do some of your questions in a minute. Go ahead, Andrew.
Thank you. Thank you. So yeah, we've been in the midst of it since January, since the beginning of the year. And it's crazy to think of that. It's only been a year of vaccinations, but it's been a year of vaccinations. So when everything started with vaccinations, we were a natural fit because of all the work that we've been doing with flu. And so we got approved from the CDC right before Christmas of last year. And I remember I texted my team and I'm like, hey, we got approved. And they're like, got approved for what? I'm like, we got approved to do COVID vaccinations. And they're like, what? I'm like, what? I'm like, get ready. So what that looked like, I didn't know. This was a whole new world for everybody, you know, including the hospitals and everyone in healthcare that was about to administer, were just administering the vaccines, let alone to the public. And we started off working with who we work best, or who I've been working with for a long time, and that's our healthcare partners. And so we were working with the doctors, we were working with the nursing schools, the medical schools, to make sure that they got their vaccines, and we trained them on how to properly administer, to mix, to prep, to all that fun stuff, because they were eventually going to be the workforce for these super pods. All the nursing schools, the EMTs, everybody that we worked with for about the first month of COVID vaccinations that we were doing, mostly healthcare workers, or those that were going to be working 12-hour shifts a day, you know, out in the field for the next 2 months. And so that was an honor, and that was great. And then we started focusing on all the long-term care facilities, the skilled nursing facilities, which was a whole new world for us as well. We've been focusing so much in the past couple of years about just community, but now this was a whole population that, you know, really needed our help because they were the most at risk. So that was really interesting, and we still continue to work with them to this day. I think it's been a lot of partnerships with CAL FIRE and the local pharmacies and the hospital systems and us, and some other groups as well too, who have been out there going out to do these mobile vaccinations for these hard to reach folks in the beginning, and they still continue to do this work to this day as well. From there, we started working our way towards the community once it was approved. So if you remember those long lines, or if you were trying to get your shot as well too at that time, really long lines, a lot of questions, really trying to make sure that we were practicing the best medicine, you know, and do because if someone has a bad experience, there goes their chance of getting a second dose, or, you know, leaving that misinformation so others won't get their shots. So really trying to make sure that we do our best so that people have that trust, not just in us, but in the whole system as a whole. So what was really nice and what was really amazing is that we've had all these partnerships, thankfully, you know, thank you to all those leaders with the nursing associations and the doctor associations, but everyone came together so much once the vaccinations came and they were ready. We had leaders who we hadn't talked to in a while. We're like, hey, let's make this happen. Let's work together. How does your process work? What can we do to make sure people have access to the vaccines? What are some ways or processes for this specific population, right? If we're working at a church, you know, is it going to be a drive-through? Is it going to be a walk-up? Can we do a combination of both? How are we going to tackle the homebound patients? And for those of you who may not know what homebound really means is, you know, a lot of seniors, they could be seniors who don't have anyone that kind of supports them. And so they live alone and they may not have any resources. And so who's helping them out if they're too scared or they can't drive to a pod? Or let's say they just had surgery and they just got 2 hip replaced and they can't leave anywhere, right? So we're able to go and support that population. And within that population, if they speak English, they're able to really ask for those resources. But what if they don't speak English? how they're able to call to receive that resource. So there were so many little things we had to think about, but I'm grateful for all the partners that were there through the county and all over the place that were able to support us with those solutions. And then as time went on, you know, we were able to focus on the businesses. And now that we're doing schools for the pediatric Pfizer vaccines, that's been a whole new can of worms. Thank you to all the doctors again. Dr. Rivera, if you are here, thank you. You've been a great advocate for that as well too. If people have been trying to reach me and text me, I'll get to you eventually, I promise. It's just been really, really, really busy. But the whole process as a whole has been amazing. All the CBOs have come together to really make sure that we've been able to work together and make sure that their clients and the population and their community receive not just the vaccine, but the accurate information. And if I'm sure the buzzwords you've been hearing the past couple months, community health workers, the promotoras, right? They have been such an asset, of course, for the past few years, but to right now at this moment, they are in such high demand. So if you have community health workers, if you're one yourself, if you're looking to be one, just thank you for all the work that you do, because you are the trusted folks that the community looks up to for that information. If you are supporting with the vaccination efforts, whether just sharing the information, doing the educational piece, if you're at an event, just supporting in that role, thank you, because without your help, we probably wouldn't have so many vaccines in arms as we do now. And we continue to ask for your help now that to help with the little ones. I like to call it Pfizer Junior, but if you're still within that scope, if you're still within that work, please continue to be in the fight. As one of my colleagues, a public health nurse with the county, said, we're in the home stretch now, right? We got the little ones, we got the majority of adults, you know, we're still working on that, we're chipping away, but we're in the home stretch now for Pfizer Pediatrics to make sure that they get their shot so that, you know, we can go back to our schools and be safe and hopefully be ready for the holidays, not just the ones coming up, but for the coming year. So we're almost there. And how do you, what if you want to host a vaccination event, or how do you get involved? So for us, we are still actively accepting sites. So if you're a CBO, if you're a business, if you're a school, whatever it may be, we can go to you countywide. We don't ask for insurance. At the moment, we don't use My Turn, so there isn't an appointment system, so it's a little easier. And so if that's something that you want to do, please reach out to me, to Champions for Health. You can also work with the county. They do have an interest form that you can complete, and we can go and get you, we can make a site for you that way. If you would like to volunteer, whether as a healthcare professional or as someone as admin to help with the lines or complete the paperwork, we are also actively looking for those volunteers as well. Bring those comfy shoes. We'll provide water and some snacks because it's going to be a good busy 4 hours. But I just remember at the beginning of the year, so many people that weren't in healthcare, you know, they were attorneys, or they were working at a CBO, or they were working at FedEx. They really wanted to volunteer their time. And especially if they were working with us at the farms, you know, working with the migrant workers, they're like, whoa, how do you guys do this work? This is so heartening work. And I think that providing that service and really just seeing the effort that it takes to make sure people are safe, it's just so amazing. So if that's something that you're interested in, feel free to reach out to us or to the county. We're happy to go and help you that way as well.
Great. Thank you, Andrew. Being a palliative care physician and having practiced in hospice for many years, having people who are homebound, it is hard for them to get access. They can't get out of the house. Their family members can't leave to go get it themselves sometimes because they're caregiving. So the people who are not able to go out and get healthcare has to come to them rather than the other way around. Really appreciate that. And certainly any group that I'm worried about, I feel like Champions is working with to vaccinate or, has a partner that they can help get to them, as well with the county. So I'm really grateful. So we have some time for questions. I'm sort of keeping an eye on the chat. If you guys are in the feed loop, please go ahead and put a question in there. Happy to get them answered for you. Otherwise, we can keep talking because we've been doing a little bit during the pandemic, but wanted to make sure we give you some space. And thank you, Lisa, for the appreciation. So I guess while I'm waiting for that, I mean, maybe everyone has their questions answered, but I guess I wanted to say a couple other pieces of gratitude while I'm sort of waiting, whether it was people helping us get early content onto our website. So a lot of physicians and even some of my trainees in our fellowship donated time to get information up about telehealth, about COVID, about hand washing, just collating resources for our community. Be There San Diego did a lot of work with us, especially at the beginning of the pandemic, to get information out to our docs. Really, really appreciate that. And to all the physicians who worked together with me and with our group to think about what would we do if the system got overwhelmed, which of course, thankfully has not happened. But, we were actively very concerned about that, and obviously still are, unfortunately. So, but just really grateful to everyone who really jumped in to help. I think the power of these organizations, people don't know, well, why should I be part of, volunteer with an organization, or why should I be part of a medical society if they're a physician? It's because the community is what can help us get there. We can advocate to get payment for getting paid for vaccinations. We can help people get to grants. We can help connect you to information and resources. And we can help you get out there in the community when you know that you want to give back and help solve the problem. I'm just grateful for Champions for giving people an outlet there, and so many others in our community, because I know everyone's tired, but everyone's still working really hard. And also for supporting the healthcare workers around you. I'm just going to throw this out there. People are really tired, and this is continuing. And so I would just ask all of you who are listening to this to please reach out to the people who are healthcare workers in your sphere and just give them all love. They may not tell you that they need support, but they do. Really, I would say the same for teachers. I think it's been really hard on all of us actually in our community. So I think please be careful out there. Well, I'm not seeing a ton of questions, so I guess wanted to ask you, Jim, are there any lessons learned, I guess, from working together and thinking about the pandemic, whether it's something recent or something you learned while you were president?
Yeah, I think a couple of things. I think one, the way our healthcare system, our economy in general is constructed is sort of based on a just-in-time principle. And we don't build for disasters necessarily. So the hospitals and the medical groups, we just have just enough stuff to take care of what we have to take care of today and tomorrow and maybe next week. And there isn't really a way economically to fund surge capacity. So I think sort of at a more macro level, we need to take a look at that, because we were caught with our pants down on this one. Even though we saw it coming for a few months, by the time we mobilized, and I think San Diego County mobilized earlier than most and put stuff in place earlier than most. Thankfully, we did. And a lot of thanks to Dr. Nick and our county medical colleagues at the time that were really pushing for aggressive early action, because I think it saved tens of thousands of lives. But we just don't our system doesn't allow people to build surge capacity. And I think we really need to take a look at that. That was kind of a macro lesson. I think sort of on a more, closer to home level, I learned again, as I have many times in my life, that people who are panicking don't process information very well. And we just had some very intelligent people were coming up with some really crazy stuff early on, especially. And it's because, everyone was panicked. We were seeing our healthcare, our coworkers, our colleagues in Italy and China were dying trying to take care of patients. That's not supposed to happen, right? And we didn't have a way to protect ourselves necessarily. Like I still have on the floor of my office, my paper bags where I cycle through my N95 masks to make them last longer. They're still back there. I have number 1, 2, 3, 4 of my paper bags lined up with their N95s in them. So, so people, I think getting the information out over and over and over again and going back to what do we have hard evidence for? What don't we know yet, and being transparent about that, and just kind of being honest, like, here's what we do know, here's what we don't know, this is what we think is the best approach given what we know at this point, and not pretending like we know everything about COVID, because we didn't. So I think those were some of the lessons learned, is that the information has to be repeated over. I tell my folks, if you really want something to sink in, you got to say it 6 times and in different formats, and different people receive things different, learn differently, right? So the town halls helped a lot of people, but not everybody could do a town hall, or that wasn't the medium for them. They wanted to see something in writing, so it's on the website was better for them, or getting an email from somebody might be better for them, or just having a face-to-face, so everybody learns differently. So those are some of the things I learned.
Great. And we actually have a question, so I'm going to ask that out loud, and then you guys can answer it, take turns, feel happy to. So, so we have a question that says, first said, thank you for sharing. And then said, what opportunities do you see to continue these regional collaborations, preparedness, and crisis response beyond infectious diseases, such as mental health or opiate overdose? What do you guys thoughts about that?
I mean, I can go and talk about that a little bit. So for example, with all the partnerships that we've created so far, that we've grown, not just with the healthcare community, but with the CBOs and just the businesses. For example, today, we have 3 events. We're doing a senior, low-income senior housing complex that's happening right now. We're doing a shipyard, which, they're all employees, they're all staff, all there for their vaccinations, but that's an opportunity to talk about mental health in the future, or diabetes, or whatever it may be. A lot of them, may live across the border, or may live close to the border, or vice versa. So there's that opportunity there. So I think that this has started a new way for us to at least build upon the work that has been done so far. For example, with our work that we've been doing with vaccinations, since we've been able to reach so many people, we're partnering with the CDC and the county to do TB elimination and risk assessments. So, it's just a sandwich of COVID and flu and TB all in one, if we're able to capture that, right? So if it's just being able to really grow those partnerships and see what we can do, at least on our end.
Great, thank you. Jim, thoughts?
Yeah, I think, this is it's really an important question. As a primary care physician working in a community health center, we've known for a long time that social determinants of health have a huge impact on health outcomes. Some of my patients don't have a refrigerator to put their insulin in, for example. So how am I going to effectively treat their diabetes? And if I don't, they're going to end up in the hospital with a heart attack, stroke, or amputation, kidney failure, all of that stuff. So, but medical systems are neither funded nor well equipped to deal with things like housing, health illiteracy, general illiteracy, mental illness that really prevents people from taking their medicines, all of those things. I'm a doctor, my clinic it's sort of in this space. We do a lot of behavioral health, but really, if someone's living in their car, it's just really difficult. So we really need these community-based organizations to, and I think as time goes on, we just need to get us all kind of more integrated than we are. We're very fragmented. 211 San Diego does a good job of sort of being a central resource and kind of a triage, serving as sort of a triage function. And we have a community information exchange that at least is the start of sort of getting some of that information all in one place. But I think we really need to build on working together, healthcare systems and community-based organizations to improve the health of everyone in our community.
Yeah, and I guess, Dr. Costa, I would say that, I have, maybe it's just a function of being president during a pandemic, but, the amount of networking that has happened during this crisis, I think has actually been, like I said, sort of the silver lining that people have pulled together. And I think that we are now more aware. Now, maybe some people always knew everybody else, but I know for me, it was quite an eye opener in the worlds that I sort of run in. It's been really helpful to understand and learn more about who is out there in San Diego County and how do they interact and where is their opportunities for collaboration to empower both organizations to take care of people better, right? And what is information that we need to know to deal with these issues of health equity, right? I mean, the healthcare system is inequitable, we know that, and so always trying to learn from each other and get information, and then thinking certainly mental health issues and unfortunately substance use disorder and opiate overdose are not going away, and so I anticipate this. It will be interesting to see what happens, 3 years down the line, 5 years down the line here in sort of hopefully we'll be on top of COVID at that point. I don't trust COVID, I don't know. But I think that some of these partnerships and these relationships that have formed, I think are deeply important. And I think give us opportunities for collaborating on many different things in the future, depending on what's going on. And unfortunately, the thing that is most urgent generally gets the most attention, but there are chronic issues that are very important that we need to deal with. And so hopefully when we can breathe a minute, we can start to think about those in a more holistic way and think about who we know that would be fun to work with and, have overlapping goals.
Well, this is a recurrent issue too. I mean, we saw it with the hepatitis A crisis. We're seeing it again with the Shigella outbreak right now. So I think it does need to be addressed. There is an organization that is working on this. There's Accountable Communities for Health, it's a subset of the Be There under Kitty Bailey. And so working with community-based organizations, community members, the county, 211, medical societies, so they are doing some work in this space already, and that just needs to be advanced.
I see there's a question about if LiveWell can invest in preparedness. I don't know because I can't speak for LiveWell, but I think all of us need to encourage and think about preparedness in the future and supporting our public health infrastructure, because what we've seen is this is had been a deep challenge. It's been underfunded for a long time, unfortunately. So, but yes, any way we can sort of keep that going, because again, it becomes non-urgent but continues to be important, right? And falls out of the main view. There is a question asking about, do you feel there are enough vaccine providers in San Diego to accommodate all the event requests that CBOs are submitting? I think that's a question for you, Andrew.
That is a very good question. I think all of us that are currently doing the work are doing the best that we can, or maybe at capacity. One of the things that we also need to take into consideration is that there's a lot of opportunities for people to go, or places for people to go, options. So they can go to their PCP, or their community clinic, their local pharmacy, events where partners like us may be hosting, right? But we also need to think about some of the small practices or just the small providers that may not be able to have COVID vaccines because they don't have the staff, they don't have the technology, they don't have the fridge. So I know the Medical Society has been amazing in trying to work with those providers and those partners. But I think now that we have vaccines for the little ones, the need is there again. So we'll see. I mean, I know all the providers are coming up. They're all trying to help to the best that they can. And we'll see now that maybe small private practices for peds may be able to do it. Some other ones too. So hopefully, right? But time will tell.
Thank you. I know it's a challenge because there's an ebb and flow in demand. When something gets approved, then the people who are like early adopters, there's a big rush to get everybody vaccinated. And then there's like the slog work of like trying to make sure for people who are unsure or have questions, making sure they get their questions answered and then getting them in. So the need for, ebbs and flows. And then with the boosters, and this is going to be an ongoing issue though. And so I think it is a little hard to predict. So yeah, thank you for your patience for people who are out there. And Andrew, thank you for reminding everyone. Their vaccines are now more out into the community, more out in private physicians' offices, as well as the large organizations. And that's important to know because early on it was hard for them to get vaccines because they were going to some of the large vaccination sites, understandably, to get large communities vaccinated. But there's more opportunities, but we still need to go to communities as well. So. All right, I think we are kind of getting close to time. I know, Jim, you sort of shared your lessons learned. Andrew, any lesson learned from this that you wanted to share with the group?
Yeah, just really quickly, I think it's been wonderful learning all the new partners, or working with all the new partners, but also learning how to work with them. So for example, a clinic at a supermarket is so different than a clinic at a skilled nursing facility, and so different than a long-term care facility, and so different than a business. And then also, if you think about the area as well, one of the amazing things that we like to do with any of the new volunteers would be, if we're going to work in a space where there's a large, if there's a population, a certain large amount of a certain minority population, kind of think about how do we address this population? What's the best way to have that conversation? What are the things that they may be thinking about, so that everyone is on the same page and that we're respectful, because we had a lot of providers and partners that, maybe worked in a different location in San Diego, or lived in a different location in San Diego, and are coming to help because their heart is in the right place. But we want to make sure that we were able to really be careful and provide that care for those folks. So I think that's been something that I learned for sure.
That's great. Thank you. Yeah, thinking about how we can be culturally appropriate and respectful is deeply, deeply important. And it's a matter of listening and learning. And I think all of us hopefully have been doing a lot of that in the last couple of years as well, and ongoing need. I guess what I would say is my learning is that we just need to keep messaging that misinformation and disinformation is so strong. And so all of us, please contribute to one, checking your sources before you retweet something, make sure it's from or pass on something to your friends. Please make sure you're getting information from reputable sources based on evidence and science, and please help spread the word and amplify those things. It seems like, oh, everyone should know this by now, but honestly, it is, I do sound like a broken record, and it's okay. People and allowing people to ask questions in a way that we don't immediately judge them, because people do actually have legitimate questions and are worried, and they are thinking about it. If they bother to ask you a question, they're curious in some way. So I think that's been important for me to learn to listen and not listen to respond, but just try to understand. So I guess in closing, what we would like to ask you to do is make sure that you are vaccinated, boosted, encourage the people you love and care about to do the same. When possible, get those kiddos vaccinated. That's, there's lots of different places to do that. Help pass on that good information. Please get your flu shot. I know normal vaccinations have kind of gotten pushed down, unfortunately, with everyone sort of trying to stay away from healthcare. Please get your healthcare. Please get your flu shot. We really need it to avoid a twindemic this year because people are out and about. Masking is critical. I'm going to tell you again, I might broken record self, but wear a mask indoors, in crowds, and certainly around people who are not vaccinated. I hope you all have a good holiday season that's coming up, and please be extra careful because when families are mixed, that's when it spreads and you could hurt people that you love dearly without knowing that's happening. So some of these over-the-counter tests, you can do that even before you go to dinner with your family to make sure you don't have an asymptomatic case and that you're not bringing it with you. So, and if you can, San Diego's lovely, we can eat outdoors, where, back home in Kansas City where I grew up, that's not possible, it's freezing. So, there's just do your best to keep it up. I know it's tiring, but please help teach everybody around you, because I know you probably all know this. And then I would just ask you to keep supporting your community-based organizations and Champions for Health, and please get involved because we need all of you. It's a long haul and we're not done yet. So thank you for your enthusiasm. Thank you for being here today. And thank you for just hanging in there and being someone who can actually make a difference in your community, one person at a time, because that's what we really need right now. So thank you so much, everyone.